Hi, I'm Dr. Becky Lynn. Don't forget to like, subscribe, and comment. So today I'm going to be talking about the birth control pill and how it affects your sex life or doesn't affect your sex life. First, I'm going to talk about how it might positively affect your sex life, and then I'm going to talk about how it might negatively affect your sex life. And I think this is really important because so many people are on the birth control pill. So first, the birth control pill might positively affect your sex drive in a couple ways. The first is that you're not gonna get pregnant. So if you're constantly worried that you're gonna get pregnant or you're thinking about it in the back of your mind, am I gonna get pregnant? That really is a mood killer. It gets in the way of your sex drive. So that's the first thing that the birth control pill can do. It sort of frees you up. But don't forget to wear condoms if you're worried about sexually transmitted diseases. If your partner hasn't been tested, if you haven't been tested, if you're not sure what's going on, how monogamous you are, you should always wear condoms to protect against sexually transmitted diseases. But condoms aren't perfect at preventing pregnancy, and in fact, nothing is perfect except for one thing, hysterectomy, well, two things, or abstinence. Anyway, the birth control pill might free you up to feel less concerned about pregnancy. The second thing the birth control pill might do is it might help with irregular bleeding. So if your periods are really irregular, or they're heavy, or they're long, maybe they last 7 to 10 days, or you have several days of spotting, the birth control pill can really lighten your menstrual flow and help regulate your cycle so you know exactly when it's coming, and maybe it'll shorten how many days you bleed for. So that really helps when it comes to having sex, because if you're worried about getting blood all over the place, not so disinhibiting, not so exciting. So that's another way the birth control pill can really help. Another way the birth control pill can improve your sex life is it can help with cramps. So if you're constantly feeling crampy, that can make sex uncomfortable. That's kind of a mood killer too. And the birth control pill also helps take away the pain from endometriosis. Endometriosis occurs when some of the tissue that's normally inside the uterus, or the uterine lining, which is the tissue that you shed each month, ends up outside of the uterus in the belly. It can be sitting on your ovaries, it can be sitting on your bowel or your bladder, and it can make sex painful. So being on a birth control pill can actually decrease the pain that's related to endometriosis. So the pill does have some benefits for your sex life. But the pill also has some negatives when it comes to your sex life. So first of all, when you take a birth control pill, you swallow the pill, it goes to your liver. Your liver makes a protein called sex hormone binding globulin. And that protein binds to the testosterone that's floating around in your blood. And yes, women, you do have testosterone. You certainly don't have as much testosterone as men, but sometimes testosterone can be a bad actor when it comes to acne. Testosterone can give you oily skin, it can give you some little facial hairs. So one of the benefits of the birth control pill is it lowers the level of testosterone. And that's why all birth control pills that have estrogen in them can help with acne and facial hair. But when they lower your testosterone level, a low testosterone level can do two things. Number one, it can cause some vaginal dryness. So the opening of the vagina, which is called the vestibule, is testosterone sensitive, which means that it needs some testosterone to help you lubricate during sex. So when you take a birth control pill and that sex hormone binding globulin goes up, testosterone binds to it, and then that testosterone isn't free or available to float around in your blood, reach the opening of the vagina, and help with lubrication. So it can cause some vaginal dryness. It can be so bad in some women that it can cause tears or a little bit of spotting during sex. We don't know why some women develop dryness from being on a birth control pill, and other women have no problem with it. But it definitely can happen from being on a birth control pill. And there's plenty of ways to treat that. You can use a lubricant, and there are many, many lubricants on the market. Or you can add back a topical in the vagina, estrogen and testosterone. There are a couple ways to do that. I will say that there is no FDA approved topical testosterone cream for the vestibule. But there have been several studies looking at topical testosterone as a treatment for postmenopausal vaginal dryness. And it seems to work very well, but you have to get it from a compounding pharmacy because there isn't one that you can have your physician write a prescription for. I have been using another product off-label that also gets converted to estrogen and testosterone in the vagina, and it seems to help with that dryness related to being on a birth control pill. Or you can change your birth control altogether. There are a variety of other types of birth controls or methods of contraception that don't cause vaginal dryness. There are IUDs or intrauterine devices. There's Nexplanon, which is a skinny little rod that goes in your arm. There's the Depo-Provera shot. There are many other things. You could also do a NuvaRing, which is a little flexible ring that goes in the vagina. It's also contraception or birth control. And it gives you estrogen and progesterone. It prevents the ovaries from releasing an egg, which is how it works for birth control. And it affects that sex hormone binding globulin much less. That's one way that a birth control pill can get in the way of your sex life. Another way that it might contribute is when you lower a woman's testosterone. We know that testosterone plays a role in sex drive, but there are so many things that factor into a woman's sex drive. It's not just testosterone. It's other neurotransmitters in the brain. It's what you were taught growing up about sex. It's, what your religion taught you. It's if you have chronic illnesses like depression, anxiety, and of course your sex drive has everything to do with your relationship. So yes, the birth control pill can lower testosterone levels. So sometimes when I see patients who have low sex drive, I don't think it's all a testosterone problem, but I might switch them to a different birth control that affects the testosterone levels much less, just so we can sort of fix all the little things that go into why a woman might have low sex drive. If you have any questions, I would be happy to answer them in the comment section below. And in the future, I may even do a Q&A, so please leave questions below and I'm happy to answer them. So have a lovely Sunday and I'll see you next time. Bye-bye.